Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the National Native Network webinar series on cancer risk reduction in Indian country. This webinar is titled A Motivational Interviewing Approach to Public Health. This technical assistance webinar is being hosted by the National Native Network, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian country, and the Indian Health Service Clinical Support Center. Your presenter today is Rodewald, PhD, Tobacco Program Manager with the Southeast Alaska Regional Health Consortium. Since 2011, Edie has worked with the Southeast Alaska Regional Health Consortium, specializing in tribal health promotion and tobacco prevention and control. In 2003, Edie completed a training of trainers symposium with Bill Miller and Steve Rolnick, authors of Motivational Interviewing. She's trained in motivational interviewing within many healthcare settings, helping staff pay attention to the language of change that strengthens clients' resolve to make changes they need at once. Edie completed her PhD in 2012 with a dissertation focused on empathy and learning skills. She strives to spread best practices that address public health and social justice goals. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. To obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey, which will be emailed within the next 24 hours. By the end of this webinar, participants will be able to examine the empirical support for using motivational interviewing in the healthcare setting, identify the importance of motivational interviewing, and apply the general principles of motivational interviewing to assist patients to modify health behavior to achieve best health outcomes. If you have any questions, please type your questions into the question box on the lower right-hand side of your screen. Questions will be answered during the last few minutes of the webinar. And now at this time, I'm going to throw it over to Edie Rodewald.
Greetings and happy solstice, everyone. We've finally reached that point of the shortest day and the longest night. So this could be kind of depressing, but if you're an optimist like me, you're excited because the days are getting longer and the nights are getting shorter. I'm really excited to be here today to share what I know about motivational interviewing. I was first introduced to MI in 2000, so it's been about 16 years. And at that time, I was managing a home visiting program for stressed families with new babies. And we really struggled in our program to engage parents, even though there was so much good information that we wanted to share with them. This 2-day motivational interviewing workshop that we did had such a dramatic effect on our program that we began to really change the way we conversed with the parents and the participants in our program. And parents started really showing up for their visits, getting engaged, and we developed a waiting list for our program. So I was really sold on it, and I've been working with it since then. In 2003, I was actually trained by Bill Miller and Steve Rolnick, who are the authors of Motivational Interviewing, to become an MI trainer and joined the network of trainers. So through my practice and my training of others, I've really become increasingly interested in how to work more effectively with people who struggle with or who are disengaged when it comes to taking care of their health. So while my current job is in tobacco prevention policy, I really continue to promote motivational interviewing as evidence-based practice for anyone working in population-based health. See if I can get this. So the objectives for today are to really talk about how motivational interviewing is evidence-based practice. And what we mean by that is we've looked at there's hundreds of articles and random controlled trial studies of motivational interviewing and looking at its effects on lots of different fields, not just healthcare. It actually started in addictions in 1983 is when Bill Miller first conceived of this kind of the psychology of change is what he was interested in. But there is lots of evidence that motivational interviewing outweighs the traditional advice-giving, education-giving approaches, and especially when lifestyle change is required. So it's a person-centered approach that is getting lots of interest in healthcare settings, and why it works. I want to talk really about the spirit of motivational interviewing. That's really key, and without it, then it's just a series of techniques that are not going to be effective. And so finally, though our time is really short today, I want to review some general principles that you can start to apply today. And my hope is, oops, I don't know what's happening to the slides. My hope is that you can take what you need from today, that you come with an open mind, a beginner's mind, and see how you can walk away with not just a basic understanding of what motivational interviewing is, but also a desire to learn more. So Mike, can we find out how much background experience people have with MI that are on the webinar today?
Sure thing. Let me go ahead and pop the question up here. The first question is, have you ever had a motivational interviewing workshop / training? I'm going to launch the poll now. So far, we've got about 72% that have voted so far. Edie, are you on the right slide there that you want as well?
We should be on slide 3 when we get back.
Perhaps something like that.
Yeah, I don't see it right now, sorry.
Okay. Then we've got 86% of the folks that have voted. We've had the poll on for about a minute. So we can go ahead and, do you want to close the poll, Edie?
Oh, do I close it?
No, I can close it. I'm just asking if you want.
Yeah, yes, please.
All right. Go ahead and share the results out. It looks like about 47% have and 53% have not.
Great. Awesome. So almost half of you. That's great. I think we asked the second question.
Okay. Then the second question is, have you ever had a 1 to 2 day motivational interviewing training? And we'll go ahead and keep the poll open for about a minute. So far, about 75% of the people have voted so far. %. And it's been about a minute, so we'll go ahead and close the poll. 87% of the participants have voted, and we'll share the results. And it looks like 29% have taken a 1 to 2 day motivational interviewing training, and 71% have not.
Awesome. Thank you so much. So it looks like a little less than half of the group has had some MI training, and about a third have had a 1 to 2 day workshop, which is great, because what we're going to do today is an overview. You're going to hopefully leave with a few ideas about how you can begin to use some of these skills right away to achieve better health outcomes with the people you work with. But really what's recommended is a minimum of a 1 to 2 day workshop to fully understand the way motivational interviewing works and what's the dynamics of it. So you should be, let's see, this slide. So motivational interviewing defined, this is a very brief definition of it from the most recent book or edition of motivational interviewing in 2013. It's a collaborative conversation style for strengthening a person's own motivation and commitment to change. So in the motivational interviewing partnership, or that collaboration, the helper, the healthcare person, does less than half of the talking, ideally. It's a spirit of positive interpersonal atmosphere that is conducive but not coercive to change. And the patient expertise really has to be activated as a condition for that change to occur. That's the philosophy behind motivational interviewing. And motivation itself, just looking at that word, it's a state of readiness. And it can fluctuate from minute to minute, but certainly from one time to the next. And it can be influenced. And it can be influenced in that interpersonal context. And what motivation really consists of is the readiness, that it's the right time to make a change, the willingness that the person has decided that if they want to and are willing to do the work it will take, and that they have the confidence, the ability to change. So, and what we really want is to build that confidence so that people can make that commitment. Motivational interviewing is learnable, and I can tell you that even a little bit of skill can go a long way. So I talked about the home visiting program that I was managing. One of the home visitors was very excited and enthusiastic about the skills that she'd learned and started using it with a teen mom that she was visiting. And this was not a very engaged mom and missed more than half of her visits probably. And this mom said, "What are you doing? You're doing something different, aren't you?" And the home visitor said, "Yeah, I am. I just went to a workshop. I'm really sorry. I'm so bad at it. I just thought I would, they told us to practice." And this teen mom said, "Well, keep doing it because I like it." And she did. And they developed a different way of working together where they both shared their expertise. And this young mom became very engaged and was our top parent. Never missed a session for a couple of years after that. So it does work. It is learnable. And you can learn it in a fairly short amount of time, but practicing it takes a lifetime. So evidence-based practice, it's a series of techniques and interventions that have shown to have a positive effect on the outcomes. And it's really done through some very rigorous empirical research and evaluations. The motivational interviewing, what the findings are, is that it mobilizes the resources that are already within the participant or the client. And that's really a much underutilized resource in healthcare. People with chronic health conditions drive 80% of our total cost of healthcare today. Now, you would think it would be the acute situations, but it's the chronic health problems that are associated with a whole complex array of lifestyle and medical treatment issues. And they require lifestyle factors like diet, exercise, drinking. So when we are able to mobilize the resources that the client brings to the health setting. It's low cost, it's high efficacy, and it's compatible with the healthcare delivery system that we have. So it doesn't assume that there's going to be a long-term client-therapist relationship, and even a single session has been found to invoke change. A motivational interviewing can be delivered within the context of a larger healthcare delivery system because it can be done in 5 to 10 minutes. Certainly, motivation is a strong predictor of change and of these lifestyle behaviors that we are looking for. And so when people are engaged, we have a better chance of helping them treat their chronic condition. And also it's been found to be like a prelude to other healthcare interventions. So once people are engaged, they can go on to more of a educational setting to learn how to care for themselves, but that motivation has already been started. So here's a meta-analysis that, the meta-analysis of medical care. This is a meta-analysis is like the crown of all literature reviews. And in this one, it was done in 2013. It included 48 studies and over 9,000 participants. And it was in a medical care setting. And the findings show a statistically significant advantage of motivational interviewing over traditional care, which tends to be advice giving and more educational delivery approach. So even when you looked at different patient characteristics and different kinds of settings, it still was robust, and it was also effective even in very brief consultations. And one other finding was that it was robust across all patient characteristics, but when you looked at just minority populations, it actually had a double effect. So this is a very effective approach to use with American Indian, Alaska Native populations and other minority groups. So what's at work here and why is motivational interviewing needed? I want to talk a little bit about ambivalence, because this is kind of a sort of the block to motivation. And often it's when you see somebody that has ambivalence, it's characterized as, well, that patient is really resistant, or they're really unmotivated, they're just not ready. But actually, ambivalence is a really normal part of behavioral change. So I would describe it as there's one part within the person that wants health, that wants and knows that change is needed. And then there's another part that's really pretty comfortable with just how things are. It doesn't feel a need or want to change. And so in ambivalence, there's this reluctance to change the status quo, how things are now, because those things are familiar. And there's inertia in just leaving things the way they are. And change requires effort to overcome, and there's obstacles. So within a person, there's these arguments for change are constantly at play. And it's kind of been described like having an internal control committee that's, there's one side talking about the urgency and the advantages of making the change for the person's health. But then there's that other side that is constantly opposing it. And as a person is kind of going, listening to their own mind, have this internal conflict, is kind of unpleasant. And so people just stop thinking about it altogether. And then when that happens, of course, status quo prevails, and at least for the time being. So ambivalence is why motivational interviewing is needed. But there's another force that comes into play, and ambivalence actually kind of starts this going, and that is the writing reflex. And so as healthcare providers, we come to our professions with really good intentions. We want people to not have to suffer. We want to help people. We set them on a better course so that one that we know, we don't want them to stay on a course that we know will lead them to pain and suffering. So we want to make it right. We want to fix it. So let's think about what happens when somebody comes into a a session, a healthcare session, with ambivalence about making a change. They feel that urgency and that need, but they have that other side that just doesn't want, that feels comfortable with things the way they are. So we can play the scenario out with a situation about drinking. Well, of course, drinking is where Bill Miller started this this approach back in 1983. But so the doctor says, the person has high blood pressure, and there's seeing other health effects. And after asking some questions, the doctor says, I'm concerned about your drinking and recommend you stop drinking, at least for now. So you can kind of imagine what the patient's response would be. No way. And then, of course, the healthcare provider takes up the argument for change, because that's that desire to be helpful. And the patient's natural response is to take up the other side, the side of the status quo, why we can't change. So even though it kind of seems like it could be helpful to have this inner conflict sort of externalized, with the healthcare provider taking the pro-change side, and but in reality, it's not, because the strongest part of the argument is the one that the person hears themselves saying. And as they hear themselves giving all the reasons for not making the change, that's what's going to win over their mind. And so there's an irony here where a person literally talks themselves out of change by arguing against it. And we set that up when we argue for it. So that doesn't mean that we should manipulate the outcome by giving the people all the reasons not to change, because people can see through that, and they'll become angry and disengaged and are defensive. And defensiveness doesn't promote motivation in a positive direction. So the lesson here is that people are generally better persuaded by the reasons which they have themselves discovered than by those which come into the minds of others. So what we're going to talk about today is a way of talking with people so that they can hear the reasons for the pro-change side. It really does require a paradigm shift. So as a healthcare provider, you don't have to make change happen. In fact, you can't. You can't force change. And you don't have to have all the answers, because your answers may not be the best ones anyway. And in some ways that takes some pressure off of providers, that they don't have to have all the answers and they don't have to do all the work. And so this approach has really helped with burnout. So for healthcare professionals, that they feel more relaxed. So let's talk a little bit about the spirit of motivational interviewing, because without the spirit, this is just another set of techniques and manipulations to get people to do what we want them to do anyway, right? So the spirit of motivational interviewing has over the years been even better defined. It's kind of been a dynamic process over the 16 years that I've been practicing. But there's really 4 cornerstones to the spirit of motivational interviewing. And the first one is partnership. And I talked a little bit about that already, but both people bring expertise to the conversation. Of course, the healthcare provider has a lot of knowledge about medical care and about medical conditions and ideas for fixing things. But the person comes in with expertise on their own life and on themselves. So that partnership needs to be shared. And the spirit, the attitude is that you are working for and with that other person. The second cornerstone is all about acceptance. And there's this paradox that when people feel unacceptable the way they are, they find it very difficult to change. So once people feel accepted, then there's that openness. But this is probably the more complicated of the spirit, because it also involves, in order to accept them, also understanding their perspective. So taking the time to listen and to let them know that you really care about their perspective and their experience. Also requires valuing them as people. Not that they have to it's got an unconditional. They don't have to earn your respect, but they deserve the dignity and humane treatment just because they are human. And then people really want and need to be affirmed. And I've recently been rereading the 5 languages of love, the 5 love languages, and affirmation is one of the 5. And I know that people really want to be acknowledged. They want to be seen for all their efforts and their successes. And we don't get enough affirmation in our lives. So the next cornerstone is compassion. And this is a great thing to talk about right now during this season of sort of darkness, but also light and celebration of the holidays. And compassion is really that desire to seek the goodwill, is a being of goodwill toward others and wishing to see others free from suffering. And a really great example of compassion is this story. Was quite a while ago on the news, but this policeman found a homeless person on the street in the wintertime without any shoes. And he went back to his car and he had some shoes there and he went and gave them to the person. So that comes from a place of compassion, is that desire to reduce suffering, to seek the other person's well-being. And when it comes to health care, in the words of Dr. William Mayo in 1910, this quote, "The best interest of the patient is the only interest to be considered." And so he was one of the founders of the Mayo Clinic. And so it's really about working for the other person and their well-being. And then finally, the last cornerstone of the spirit of motivational interviewing, and all 4 of these need to be there, is this idea about evocation. And so much of our medical practice is to insert things into people. And the job of an MI practitioner is not to install motivation, but to bring forward, call forth what's already there inside the person. And so again, people tend to believe themselves and trust their own opinions more than they do those of others. And people learn about their attitudes and beliefs the same way that other people learn about them. It's by hearing themselves talk. So ideally, what we want to do is create a conversation where that person or patient is voicing their own reasons for change. So motivational interviewing is a lot about listening and about sharing that talking space. So the spirit without the spirit, all of these other things that I'm going to talk about now in a motivational interviewing context will not be as effective as if you have the spirit already there. And they also can be learned. So this is kind of like a diagram. Like, we used to do that with sentences in English grammar class. But this is kind of, what is a conversation about change? What are the steps to making it work? Well, it's not a linear process, and that's why these are circles within circles. But to me, the outer circle, the engagement, is the most important one to start the conversation with. And when I talk about engagement, I'm not saying, talk about the weather or the person's kids, but pretty quickly get the person engaged in their own thinking and dialogue about their own health, which is, whatever the goal is of your consultation. And you can do that with the way you use your words and your questions and the way you listen. Once you have the person's attention and they are actively conversing about their health, the next step would be to hopefully focus that conversation, because there is limited time. There might be, 5 to 15 minutes in a health consultation. So how are you going to maximize that time? You could spend it talking about all the things that you want to talk about, you as a healthcare provider, or you could spend it, you could find out what's most important to that person and just focus on 1 or 2 things that would have the greatest impact. So focusing the conversation quickly or early on. So what's most important to you about your blood pressure? Which area would you like to talk about, making maybe some change in? And then evoking from them. That's what we were just talking about in the the spirit is getting them to give all the reasons why that change will be important. Rather than us telling them, we ask them with open questions. Oops, that was a mistake. I hit the keyboard. So evoking and then leading ultimately to planning. And the more a person can commit to a change, even if it's especially a small change, because that's more realistic that they will take the small steps, and rather than some grandiose, complicated plan that they're going to scrap in a day or two. But what can they commit to between now and the next time you see them? That's going to have the greatest impact on their health. And the more they can verbalize that, maybe even write it down in their own writing, and put it up somewhere, have somebody to talk to about it, get support for it, the more likely they will be successful with that plan. So that's kind of the diagram of a motivational interviewing conversation. But let's talk about what are the foundational skills that you need. So you want to have this conversation, but this is a little bit different than we might be talking to our kids or to our spouses. This is a helping conversation. And the tools that we have are, we call them ORs. And motivational interviewing, if you've had any training in it, is full of acronyms. So the ORs, the O stands for open questions. Affirmations are the giving people positive feedback on their efforts and strengths. Reflecting is a listening response that helps the person speak more about their issue. And then summarizing kind of is a way to keep things organized. So motivational interviewing conversations are kind of a guiding conversation. They're not they're not so much directing, and they're not so much following. Although sometimes you may be directing, depending on the need of the person. You may be telling them how to use a certain piece of equipment, or how to take a certain medication. Those are very specific things. Or you might be just following and listening to them talk about how difficult it has been for them. But at some point you need to guide the conversation in a positive direction. And so these are the skills that you'd be using. So let's kind of work on them one by one. We have a little bit of time here. The open questions are really key to motivational interviewing. And this is what some of the things that open questions can do. They can communicate this interest in the other person. They build trust and empathy, so they help engage that person. Open questions are really engaging. And there's an expectation that that other person will share their thoughts, their story. The person has a feeling that you really care and you want to hear about it. And your open questions can guide the conversation toward more awareness of a problem or a choice, or toward strengths or efforts and actions that could be taken. So, but the thing about open questions is that they don't result in yes or no answers or very specific information. So, when a lot of medical care, we're asking a lot of questions. So what's your pain level on a scale of 1 to 10? When did you first notice that? What medications are you taking? What are you allergic to? So the question, when the sense that a person has when they get asked a lot of questions is, at the end of all those questions, you're going to solve their problem for them. You're going to come up with a diagnosis or a solution. But you're not necessarily engaging them in their own solution. So here's a list, and these PowerPoint will be available for you after the session, is to right off the bat engage the person in the conversation by some good open-ended questions. And when I first learned MI, I put these up on my wall so that I could remember some of the best ones, and I tend to use a lot of these over and over. But for example, what brings you in today? What's on your mind? What would you like to spend our time on? How do you feel you've been doing since we last talked? How are you managing with that? When you want to share information, ask first, what do you already know about that? What have you already tried? Or what do you think is going on? How did that feel for you? And then asking, what do you think is the benefit of doing that? So, certainly we ask a lot about that in smoking. What's the benefit for quitting? What limits you, when you can continue to smoke? So those are some good open-ended question examples. Let's go to affirmations. That's the A in ORS. Now remember, you've got to use all of these. If you only use open-ended questions, if you only have one oar in the water, you're not going to be able to navigate or be able to steer a direct course. You're going to be going all over the place. So remember to kind of sprinkle all of these into your conversation. But affirmations are very powerful. They help engage people, and they, hearing a very good positive affirmation is kind of like winning the lottery. There's a study that showed that the same part of the brain lights up when somebody gets a really good affirmation as when they win a lottery. It's crazy. But what it is, it's a positive comment that reflects a person's strength, their effort. Wow, you're really working hard. Their intention. You really want better health for yourself. You really care about your kids. But also it's a positive comment about the right and the capacity for their own self-direction, the autonomy to choose. So, you know what's going to work for you. You know best what will fit into your lifestyle. Those are all positive comments and affirm that person. But they do strengthen the working relationship. They also enhance self-responsibility, which is a goal of healthcare. They reinforce the effort the person's already making and support self-esteem. And self-esteem and confidence are very closely linked. So when a person feels more self-esteem, they're going to have more confidence that they can succeed. So some different examples of affirmations. You really care about your appearance. You do the best you can in any situation. This is after somebody's explained how they tried. You've already thought through this. What you're doing is working for you. Your A1C is going down. You already have a lot of ideas. You've got a really good little system there. You're very persistent. It's amazing. Even people who have high degrees, lots of education, have good jobs, really respond to affirmations in the same way. We're all human. Next, the next foundational skill is our reflection. A reflection is really, first of all, it requires that you have to be quietly and actively listening to the other person, or you won't be able to reflect the essence of what that person is saying or meaning. And the more you listen, the more accurate your reflections are going to be. The more you'll understand their perspective. And that is one of the part of the spirit of MI. So what they do is, first of all, a reflection is not a question, an open question. It's a statement. And so that means your voice, in English at least, and in our language, goes down. It doesn't go up. So usually a question is signified by your voice going up. So you don't have time to do that. You don't have time to do that. So that's the difference between a question and a reflection. There's usually a pause after a reflection, and that gives the speaker time to respond to the reflection, maybe clarify it more, further develop whatever their message they're trying to communicate. A reflection could be a reflection of what somebody's thinking or feeling as well as what they're saying. So it sounds like you really like going out and walking every day. It can clarify meaning, and if you're wrong, the person's happy to correct you without feeling, as long as it's genuinely delivered. People don't mind the corrections. And reflections really increase the time that the other person spends talking. And that's what we want in motivational interviewing, because we want them talking about change, which we guide. And it really fosters more of a partnership or collaboration, and that defensiveness goes down. And that's important for motivation to go up. A few different examples are, you found that that's really not working well for you anymore. You're feeling discouraged. It's reflecting on an emotion. You wished it could be different. Now that's guessing and a lot of reflections are guesses at what might be going on. That really gives you hope. It may be possible for you. Some of these almost sound like affirmations because they really feel affirming when you get reflected accurately, because you know that person is really trying to understand you, and you feel that caring. And then, of course, there's summaries. That's the S in the ORs. And in a summary, what you do is you take several reflections and you combine them together. And the goal is that you might invite the person to say more, explore that topic even more. You might be highlighting ambivalence that's still there, or you might be ready to move on to another topic. So some different ways you could introduce a reflective summary would be, okay, well, let me just see if I understand what you've told me so far. So it kind of slows the conversation down. It encourages that understanding and that engagement. And it may be a way to wrap it up into a planning phase. That's always good. So those are the ORs. And why do we want ORs? Why do we want to engage the person, focus on a topic, and evoke change? We need to know why we are doing this, and here's why. We want people to be making change talks, so they can hear themselves, they can talk themselves into change. And the kinds of things that we really want to hear them say are their desires. What do they want for themselves? So it's not up to us to decide what they should want. It's what they want. What are they able to do, or what have they already been able to do? What are some reasons that this is important for them to do? And then the need. Why is it really imperative? So need is a step up from reason that they do this now. A lot of people are looking at some really chronic issues down the line if change does not happen. So change talk is what we want. And there's been a lot of linguistic studies of motivational interviewing, and they've looked at what point in a conversation does a person begin to talk about making change, and then how does that correspond or correlate to the outcomes. And what they found is that the more change talk a person is able to make during a session, the more likely they will act on that when they leave the session. But then they found that there was a missing element. And so change talk is great. It's a preparatory language is what it's called. But what we really, because it's preparatory because it can contain sort of tentative language. So there might be, like, what I mean by that is like passive verbs that can lack this intentionality of a commitment to change. Yeah, I'd really like to lose some weight. I might be able to cut out the evening ice cream. I could maybe, start looking at the labels. I know I should drink less. Yeah, I could think about it. I'll think about it. So, but they don't necessarily say they're going to do it. It's like, yeah, I might think about that. I might do that. So, well, that's preparatory language, but what we really ultimately want, and what's more correlated to the change outcome, is commitment talk. And so we want to use our ORs in all of this process of motivational interviewing to get the stronger statements like, I will do that. I promise I'm going to do that when I leave here. I commit. Or action. I already got rid of all my ashtrays. I started to cut back on my smoking. So the acronym here is CAT, but it predicts the stronger the change talk and the more commitment talk. Well, usually the commitment comes at the end, and that's more likely to predict the likelihood of change actually happening. So we can't force people into this, but we can prepare them, and we can see where they end up at the end of the session. Not everybody's going to get to that commitment every time. So how do we invite change talk? We do it with our foundational skills, with our ORs. The ors are really important, but they're like the words to music. Without that, the music in the background, that spirit always running in the background, it's not going to be as effective. So remember, you've got to do this with the spirit of MI, but use your open questions to ask for elaboration. So in what ways could you do that? What else would you like? What else could happen with that? What else do you want? What else? What else? What else is a great open question to have in your repertoire. And then really using the affirmations to elicit even more change talk. So, wow, you've already been thinking about this. And then reinforcing the change talk in your reflections and summaries. So you wonder, what should I reflect? And the person just gave me all this information. Well, reinforce the change talk. When you reflect it and you summarize it, it's going to encourage more of it. And then we want to encourage commitment. And one way we can do that is using a key question at the end of maybe we had 10 minutes together. So we're going to summarize because our session's about to end. So given what you've told me so far, you might add a little summary. So you mentioned your, you started to work out a little bit, walking every day. You've cut back on your sugar. What do you think, out of all the things we've talked about, what do you think you're ready to do next? Where will you go from here? And then what's going to be your next step? And if you can get the person to write it down rather than you writing down their plan, even if it's their next 2 or 3 steps that they're going to do, then that's going to strengthen that commitment from the verbal to the written, and then to that, it's a public commitment, because you are now the witness to that. And there's accountability. So putting it all together. So you've got to have the desire, the ability, the reasons, and the needs kind of outlined before a person can talk about their commitment. So you engage the person in a conversation about a specific topic that they're ready and willing to talk about, and then you move them in a direction toward a plan, a commitment to taking even a very small step, and that will ultimately lead to the behavior change. I know this sounds kind of easy, but most of you that have had some training and have tried it know that it's not always as easy as it sounds, and it's very easy for us to fall back into our status quo because we're asking people to change, but we need to change also. We need to change how we listen and how we communicate with other people in the spirit of helping them. And this is a lifelong practice, and being on the receiving end of not good help, I'm very sensitive to it. And when people try to just tell me what to do, I get very belligerent, because now I'm so hypersensitive to that. It's like, no, I don't want to do that. I want you to listen to me and what some of the things that I've thought about and help me sort through them. So motivational interviewing, there's lots of research that shows that it works. It's cost effective. It doesn't cost a lot. It has a huge effect. And there's lots of research out there, and there'll be a couple studies that will be available after this presentation. But the spirit of motivational interviewing is key to its success. Now, even having said that, I did read a study about some doctors, which, the spirit, most people want to be helpful, but these doctors just learned a little bit of MI and like some open-ended questions and some reflections, and they were using it with patients that had migraine headaches. And when their sessions were recorded and then, kind of analyzed and coded, there really wasn't a lot of motivational interviewing in their conversations, but there was that little bit of a change from just asking closed questions to asking a few more open questions and listening a little bit better. And the outcomes were significant. People were more likely to comply with and adhere to the treatment. Doctors were less burnt out. They felt like they learned a lot from their patients about migraines, and the satisfaction of healthcare, when people rated their satisfaction with their healthcare provider, went way up. And, just looking at that. So even a little bit of the skills and the general principles will help achieve better outcomes. So I see that I am just about out of time, and I'm wondering what questions people might have. We have a few minutes, we have 10 minutes till we're done, but I wonder if there's some questions that maybe we could have a little discussion. And unfortunately, this is not the way I would like to teach motivational interviewing, but like I said, this is an overview, and I hope you leave here with a desire to learn more and practice.
All right, great. Well, if folks want to type in their questions into the question box on the lower right, we do have a few minutes for questions.
So while people are thinking, I'll just show you, here's a few resources. These are pretty recent books. The third edition of Motivational Interviewing, Helping People Change, is an amazing book. It's pretty thick, but it's got everything, if you have the time to read and the interest in reading it. But this Motivational Interviewing in Diabetes Care is a really great book as well, and Miller is a co-author of that. And then also Motivational Interviewing in Healthcare. So this diabetes care and healthcare books are paperbacks, and they're both awesome resources to augment the third edition.
So this person says, is there something not to ask or avoid?
Something not to ask or avoid. Great question. Of course, everything depends on the conversation, and you've got to be with the person. It's all about being, a way of being with others. One thing maybe that comes to my mind might be, don't ask the person. You might ask a little bit about their status quo, why they want to just keep things the way they are. But if you spend too much time there, then they're going to be talking themselves into not changing. So that there used to be more of an emphasis on kind of looking at the decisional balance, looking at both sides equally, the pro side, pro change, and then the no change side. But what the dynamics of motivational interviewing now is to spend more time on talking about change and a lot less time on the status quo. So, but maybe I could ask if you had a specific thought about that question that you were wondering about, what not to ask.
Okay, we'll see if he responds to that. In the time we had another question that popped up. How can motivational interviewing move a patient out of denial and consider change?
Into change. So denial, that's one of those words that, is kind of like ambivalence. Most people know what they need to do for their health, and most people want, they sense that urgency that if they don't do anything different, that they will experience, pain and suffering in the future. And so they may not be voicing that, but most people inside have that knowledge, that knowing. So, there are ways when people are avoiding talking about something, to spend time. And it could be that they just want to be listened to, and they want to build that trust and rapport before they really open up to a person. Everybody has a different level of trusting. And so it could be that they talk about something else that really isn't so important to them initially. And I think, once there is some level of listening and trust already built, I think it's the provider can bring up a topic, respectfully, So I wonder if you would mind, we've talked about different things, but I wonder if it'd be okay if we just talked a little bit about smoking. Smoking is something that can be a real danger for you with your condition, your diabetes. And I don't want to lecture you, but if it's okay, I'd just like to have a conversation about that. And if the person says no, it's okay. Or you might say, I notice you didn't bring that up as one of your choices, and yet that's probably the one thing that could have a big impact. What do you think about that? So you can bring up topics, but wait until there's some level of trust and rapport before you jump into that, because clearly some people just aren't ready to go maybe to the most critical, hardest thing. I don't know if that helped or not. But.
This person says, would you suggest using the given DARN and CAT terminology with the patient directly?
That's interesting. I think it depends on the situation. If you're motivational interviewing is also used in groups, and you can do if you're asking people to think about change and think about the different reasons that they might want to make a change. You could have them say, you might have Dawn down there and say, what do you desire? What do you think you're able to do? What are some reasons or needs? You could have them fill that out. Yeah. I don't think that this isn't about being secretive or manipulative. And if you're manipulating, some of these skills are used in different settings where people are being manipulated to do something that may not be in their best interest. And sometimes that's, can be a sales tactic. The goal is to get the person's money away from them and to buy something. But if you are manipulating an outcome, then you are not staying within true to the spirit of motivational interviewing.
This person says, what if your client is upset? How can I bring them back gently?
Oh, interesting. Yeah. So, upset meaning, I guess they could be angry or they could be sad, upset, sad. If a person's angry, definitely do not want to confront. And, listening to someone, so it sounds like this is really hard for you. Change, this is not what you wanted to hear today. Reflections like that can be helpful in diffusing anger. Sadness, reflections can really help with sadness. Or just, it's our humanness, that our interrelationships. I'm really sorry that you're experiencing that. And silence, sometimes just silence, letting someone just have their moment of sadness, and that's okay. I think sometimes we're just too uncomfortable with those emotions.
All right. I'll wait another minute or so and see if anybody else has any other questions. In the meantime, I'll give a little plug for our social media. We're going to go ahead and archive the webinar and get that posted up on our website. And when we do that, it should be done here in the next day or two. We'll go ahead and post out an update on our social media, facebook.com/keepitsacred. Follow us on Twitter, twitter.com/keepitsacred. Also, be sure to follow us on LinkedIn as well. We're on LinkedIn, and that address is linkedin.com/company/keepitsacred. And then we do have a webinar coming up in March that we already have scheduled. One of the Keep It Sacred board members, along with Edie, Sohaib Arif, is going to be presenting his presentation on e-cigarettes and the community. And that'll be taking place on Tuesday, March 7th, same time, 3 o'clock p.m. Eastern Time. So if you're in another time zone, just go ahead and backtrack from there. It'll be at 3 o'clock p.m. Eastern on Tuesday, March 7th. And if you go to keepitsacred.com, check on the events. We've already got the page set up, so you can go ahead and register and get yourself signed up right now for it. Make sure you signed up because space is limited in these GoToWebinar platforms as well. So the earlier that you get registered, the easier it'll be for you to get in. And we don't have any other questions. Edie, did you want to add anything else to the presentation?
No, but thank you, all of you. And I love talking about this. It's something I'm passionate about. And happy holidays. Have some fun. Thank you.
Excellent. Thank you, everybody. Make sure you register for the webinar coming up on Tuesday, March 7th. Make sure you follow us on social media. Thank you very much, and thank you for joining us on today's webinar. Have a great day.